Hey, good morning. When most people hear the word Botox, they think of something out of forehead lines or crow's feet. But a growing body of medical research suggests that this powerful neurotoxin may be the next frontier in treating some of the most personal and prevalent challenges in men's health. Today, we're looking at a series of new studies exploring the use of botulism toxin A in the management of male sexual dysfunction, from erectile dysfunction to premature ejaculation and beyond. So to understand how it works, we have to look at the biology. Botulism toxin, or Botox, produced by the bacterium Clostridium botulinum, acts as a potent inhibitor of neurotransmitters. Specifically, it blocks the release of acetylcholine, which temporarily paralyzes or relaxes the targeted muscle. While the relaxation is what smooths out a wrinkle, in the world of urology, it's being used to relax smooth muscle tissues in the penis, to increase blood flow, or to calm overactive muscles involved in ejaculation. Let's start with what some are calling Botox. Botox for erectile dysfunction. I didn't make that name up. This is a particularly significant for estimated 18 million men worldwide who suffer from ED, many of whom don't find relief with traditional pills like Viagra or Cialis. Recent clinical trials have shown that injections into the corporal cavernosa, the sponge-like tissue of the penis, can inhibit the sympathetic nerves that keep muscles contracted. This relaxation allows for significant increased blood flow. In one large randomized trial, 40% of men who had previously failed traditional therapies were able to resume sexual activity after receiving Botox injections. In another study, the response rate reached as high as 54%, with benefits lasting anywhere from 6 months to nearly a year. However, the news is a bit more complicated when it comes to premature ejaculation. Researchers have targeted the bulbospongius muscle, which plays a key role in the rhythmic contractions of ejaculation. The results here were kind of a mixed bag. One clinical study out of China reported a significant increase in the time until ejaculation, from less than a minute to over 2 minutes. Yet, in a more recent study from Egypt, they found no substantial difference between Botox and the placebo. Experts believe this discrepancy might be due to different injection techniques or the severity of the condition in different patient groups. Now, the research doesn't stop there. In cases of Peyronie's disease, where painful plaque causes penile curvature, a single study showed a reduction in curvature of about 8 degrees. Men suffering from chronic scrotal pain, Botox has provided relief lasting up to 6 months, far outlasting traditional nerve blocks. And in a pilot study on penile retraction, 70% of men reported subjective improvement in their flaccid penile length after treatment. Now, we must talk about that fine print. Currently, the FDA has not approved Botox for any of these sexual health conditions. Got that? Its use here is strictly off-label, meaning doctors are using their professional judgment to prescribe it outside its officially approved purposes. The safety profile, though, appears favorable, with less than 10% of patients reporting mild side effects like local pain, bruising, or temporary urinary issues. However, there are some rare systemic risks, such as generalized muscle weakness, and it's not recommended for individuals with pre-existing neuromuscular disorders like myasthenia gravis or ALS. So what's the bottom line here? The medical community is cautiously optimistic, but remains unanimous on one thing. We need more large-scale randomized controlled trials before this becomes the standard of care. But for men who have exhausted all of their options, Botox may represent a new frontier of hope, but for now it remains an intriguing frontier rather than a definitive cure. I'm your host, and this has been a brief health brief on the treatment of erectile dysfunction with Botox. Tonight, on Dr. Jeff Talks About Sex and Deficiency, for military veterans, coming home means rebuilding more than just daily life. It can also mean reclaiming intimacy, identity, and connection. Tonight, Dr. Jeff explores an important and often overlooked topic: sexuality after service. Military service, deployment stress, injuries, medications, and emotional trauma can all impact your sexual health and relationships. But with the right conversations, support, and care, many veterans and their partners can rediscover intimacy and closeness. This is an important conversation for veterans, partners, healthcare providers, and anyone who supports those who have served. So, join us tonight for a thoughtful discussion about healing, connection, and reclaiming intimacy after service. That's drjeffsextalk.com. Tomorrow on UroNurse, have you heard of bacteria that literally can eat cancer from the inside out? Yikes. Join me as I dive into the science behind this groundbreaking tumor-fighting therapy and explore what it could mean for the future of cancer treatment. You don't want to miss this revolutionary update. Join me tomorrow on UroNurse News.
Breaking news, clinical guidelines, and research insights delivered weekdays at 9 a.m.
UroNurse, where the experts meet. Online learning, practical and sweet.